to share how it's going, we have Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Thank you so much for being with us.
Sure, good to see you.
All right, Dr. Moffitt, initially some parents told us they wanted to wait and see some real-world safety data before agreeing to vaccinate their kids in this age group. I think, at least here in Massachusetts, a lot of parents forged right ahead and got those kids vaccinated based on the rates that we're seeing. But here we are 3 months later, and what do the numbers, the data, what does it show about the effectiveness of this vaccine?
Yeah, so we have some data both on the effectiveness and even more on the safety side now. We're at about half of children 5 to 11 in Massachusetts having started or completed the vaccine series. That includes about 200,000 in that age group who are now fully immunized. And on a larger scale in terms of safety, we got data from the CDC after the first almost 9 million doses were administered to children in this age group. And reports there showed that this vaccine has a very, very reassuring safety profile in this age group. The most common reported side effect was in pain at the injection site in about 50% of those who were reporting. And beyond that, really fatigue and headache were the next most common in about 20%. And luckily, the vaccine-associated myocarditis, reports of that in 5 to 11-year-olds have been very rare, even more rare than in the 12 to 15-year-olds. So taken together, it's a very reassuring safety profile. Its effectiveness so far at preventing infection remains to be seen, but it looks like a relatively fresh vaccine series or having been boosted, which is relevant for older people, does still seem to be effective at preventing any infection, and having been vaccinated is still highly effective at preventing severe infection in this age group.
You just mentioned it, but we know that kids have a much lower risk of severe symptoms from COVID. So what do you tell parents who ask this question, and we get this question a lot about how will these vaccines actually protect my child?
Yeah, I think if parents are really thinking about the individual benefit of getting vaccinated, so how is it directly going to benefit their child? It is true that severe disease in otherwise healthy children is quite rare, but it does happen. And we are absolutely seeing that in our children's hospital, especially in the context of this unbelievable number of cases of Omicron that we've been experiencing over the last several weeks. And we know that these vaccines keep people out of the hospital. We also now have very good data that these vaccines are highly effective at preventing the serious inflammatory condition that can occur after COVID-19 called MIS-C. So that would be another individual reason to vaccinate your child to keep them safe as an individual.
And Dr. Moffitt, as we appear to be coming out of this Omicron surge, I think we're going to be seeing a lot more public school districts around Massachusetts starting to have that conversation about when it's time to drop the face mask mandates. As we've been reporting, Cohasset just told their students at middle and high schools, even if they're unvaccinated, that they can leave the masks at home. What's your reaction to that decision? Is it time, even for the unvaccinated? Because I think a lot of schools are worried about trying to enforce some rules for some students and other rules for other students.
Yeah, I think first I would say that there definitely needs to be some clarity around the criteria that need to be met for it to be a safe time to start dropping mask mandates. I do feel, though, that community transmission rates really should be a very important part of that calculation. And that's especially true in the current setting of circulation of a variant as infectious as Omicron. So I don't think that, I would say that now is not the time. Numbers are headed in the right direction, but they're not there yet. But there absolutely does need to be some clarity around what those milestones should be in terms of community transmission and vaccine and prior infection coverage that would make us feel safe about dropping mask mandates. And I think that will be a very different discussion in a few weeks if numbers continue to head in the right direction.
All right, Dr. Kristen Moffitt, as always, we thank you so much for your time and for your insight.
Sure. Thanks for having me.
Thank you.